So next, we're going to be having a keynote address from Dr. Zainab Kwaru. And you're going to permit me to welcome Mr. Pokes to do the introduction of Dr. Zainab Kwaru, because she's going to be the keynote speaker for this time. Mr. Pokes, are you here?
Yes, I can hear you.
Yes, please, go ahead. Thank you.
Yeah, good morning, ladies and gentlemen. Once more, it's nice to be here and to have all of us on the platform. Can you hear me?
Yes, please, we can hear you. Go ahead. Yeah. Yes, you are.
Right, yeah, we can.
All right. It's such a pleasure to be here and to introduce one of our very own, one of the queens of medical science in northern Nigeria, the bride of Medical Women Association, Medical Women Association of Nigeria in the Kaduna State chapter, whose work, no doubt, has transformed the practice of medical science in northern Nigeria. Her work in Barau Diko, in the different places, and in the Kaduna State government have given hopes to many lives. And I'm sure that this morning, as she comes along and gives us this keynote address, she will address issues that will transform our understanding of medical science and bring forth an appreciation of what we need to do for the betterment of medical science, not only in northern Nigeria, but in the whole of Nigeria and even beyond. Therefore, ladies and gentlemen, please do make welcome no other person than the delectable, intelligent, sagacious, library intelligence kind of Dr. Zainab Kwaru as she gives us the welcome address.
Yes, thank you very much, Pokes. I thought you were talking about someone else. Thank you for all the encomiums. I think this is really a very timely webinar. Let me start by saying a very good morning to all our esteemed colleagues and distinguished personalities that are here present today. I would like to stand on the already established protocol to commence the welcome remarks. As the president of the Medical Women Association of Nigeria, Kaduna State Branch, it's a pleasure to have collaborated with CHealth on this 5th summit on rebranding the Nigerian health system. And I believe a lot has already been said by the CEO regarding how far we have fared as far as the health system in our country is concerned. It's no longer news that we have a system that is riddled with a number of constraints and challenges. Of course, while we have made some gains in some aspects, some of those modest gains are being eroded by a number of emerging issues. We have had the pandemic that has really set us back. And then we've also experienced the drift in terms of the brain drain, and also how our trained personnel are leaving the country in droves. This is a cause for concern for most of us that are still present within the system to salvage what we can within our capabilities. We've also seen situations where we have dwindling resources. A lot of the times, the resources to even run the basic, healthcare has really been a challenge in most of the setups, be it at the local government, state, or federal level. And then we've also had situations where there are a lot of challenges happening at the community level, where we have issues of access. We also have issues of increasing levels of poverty that has thrown people into catastrophic situations where they purchase healthcare using out-of-pocket means. And we've also seen an attempt to see how we can also improve our healthcare delivery system in terms of the contributory schemes that exist within the system. So I can go on and on listing a lot of these challenges, but what can be done and what should be done? And when should that happen? Because this is an emergency kind of situation that we have in our hands, and there's a need to see how our healthcare delivery system can be overhauled in spite of these challenges that are really pulling us back. So this summit, in another way, is an attempt to see how intellectuals can bring in their wealth of experience. They can also contribute to seeing how we can better improve what is already available to us in terms of service delivery, in terms of the infrastructure needed to carry out healthcare delivery, and also in terms of providing the human capital, the human resources for health required to actually provide these services. Because without the human capital, a lot of what we're talking about will continue to elude us. And then we're also talking about availability and ability to purchase the commodities, the medicines, and the technologies that we need to run our healthcare delivery system successfully. And then most importantly, how has the community participation been? How have we carried our people along? What more can be done to ensure that people have the right healthcare seeking behavior and they're able to support a system that works for us, looking at our peculiarities, looking at our needs, and also looking at what we need to do to salvage the current situation. Apart from that, I know that there are a number of academics among us. We talk about coming up with research products that can be used to improve our planning and decision-making processes. What more can be done? How best can we deploy this expertise to provide the needed information that will improve on our healthcare delivery? So for me, these are the things that I believe that the rebranding is all about. What and who should be involved, and then how far can we go in terms of mobilizing the needed resources to improve our healthcare delivery system. So I would like to end by saying this is a wake-up call for all of us. Let us see how each person can and each institution can play their role to ensure that we're able to deliver a healthcare delivery system that actually aligns with the needs of the people and which we can afford at the present pace of our development. Thank you, and I wish us a successful summit.